This is cadaver number 3. He is the one that died of lethal injection, and he has the best bones and muscles out of any of them. He's a big dude. He was probably working out literally the day before he died because the muscles and the bones and his whole body is in really, really good condition. He does have a brain stem tumor, which you may or may not see this time. I have no idea how it affected him, and he is missing his right testicle. Other than that, he appears to be fairly normal. Oh, I think this one might be missing his appendix, so maybe at some point he had his appendix out. So we are going to take away everything except the skeletal system to start with. And the skeletal system includes ligaments and all of the attachments. And you can see when they're together like this, it's a little bit harder to see the ends of the bones and how they, all the little parts that you guys need to know. So at some point, we'll probably take away some of the ligaments too, just so we can see the bone parts a little bit better. You guys do not have to memorize any particular ligaments. You just need to know that ligaments attach bones to bones and tendons attach bones to muscles. And Caitlin, that's something you should know for the cumulative final for A&P2. That's one of the questions on the final, as I recall. Okay, so you can divide and categorize bones in different ways, and I don't care if you really remember that. You should know the appendicular skeleton is the arms and legs, and the axial skeleton is basically the torso. You can put bones into long bones, short bones, flat bones, and then there's irregular, where they stick everything that they can't figure out a shape for. Somebody had to put them in groups, I guess, at some point. Probably more important, you should know that some bones have spongy, most bones have both spongy and compact. And spongy bones, the ends of the long bones and like the sternum and hip bone, the pelvic bones, that's where red bone marrow is, and that's where blood cells are made. That's important for both A&P2 and A&P1. And if you need a bone marrow transplant, for example, the donor, they have to stick a needle into the spongy bone and suck that out. They have now been able to take out some just blood and isolate the very few stem cells that might exist and then grow some in culture. But in still a lot of cases, they suck it out of the spongy bone. And that apparently is, lovely. Not the most unpainful experience. The person that gets it, they just get the new bone cells by IV. So the recipient, not that they don't already have trouble. I mean, they're getting a bone marrow transplant because they have leukemia or some devastating disease, but the donor is the one that actually has to put up with a little bit of the more pain. Okay, so the basic bones, the sternum, the ribs, the humerus,
radius,
ulna. Again, you can just touch on the virtual cadaver here, and it tells you, what bone it is. Ilium,
ischium,
your sit bones, the ones that when a little kid sits on your lap and it feels like their bones are digging into your leg, that's the ischium. And the pubic bones are the ones that are actually touching each other in the front, and that little piece of cartilage in between is the pubis symphysis, and that stretches in women under the presence of estrogen during pregnancy to allow for birth. And sometimes it doesn't go back together quite as tightly, and your hips are a little bigger after you've given birth. Of course, you have the vertebra, and if we turn this guy over, the vertebra are 5 different kinds. The first 7 are your cervical vertebra, and then the ones with a rib attached are your thoracic vertebra. There's 10 of them. And then there's the 5 lumbar vertebra, which form that kind of curve in your back. And pain in your back is called lumbago because it's the lumbar region. And then you have the sacrum, The
Supraspinous
sacrum
ligament.
um,
Sacrum.
is separate bones, and then as you age, at the time you're 25, it's pretty much fused into one. And then your
Posterior
tailbone is your
sacrococcygeal ligaments.
coccyx. And if you fall hard enough
Pubis.
on your butt, you can actually
Posterior
break your
sacrococcygeal
coccyx. And
ligaments.
unfortunately, you don't get a cast for that. Excuse me. You just have to sit on a soft pillow for a few days. It doesn't want to light this up for me. Come on.
Coccyx.
Say coccyx. There we go. The color of the coccyx. Green there, you can see that.
Sacrum.
Sacrum. Recolor it. Yellow, let's say. All right, we're going to get rid of some of the ligaments so we can start to do some of the more specific. There we go. Now you can see the vertebra a little bit better. So one of the things you guys have to know are the parts of the vertebra.
4. Lumbar
This is the
vertebra.
lumbar vertebra. Okay, I can color that red, for example, that whole thing. But the part that sticks straight out the back, that if you felt somebody's back and feel those little bones, these things that come straight out, and if I turn them sideways, you can kind of see them stick out. Those are the spinous processes. Okay, so this part right there. The part that goes transverse are the transverse processes. And then that round part that's actually internal is the body.
4. Lumbar
The
vertebra.
body of the vertebra is the main part of it. You can see the transverse processes real easy if you're looking through him. And then there's a hole where the spinal cord goes through. That's called the central or vertebral foramen. The foramen means hole. Now, when you get up to the cervical vertebra, again, you can see the body.
5. Thoracic vertebra.
Okay, it's the thoracic one.
7. Cervical
But you
vertebra.
can see the body of it. The transverse foramen, the part that stick out, only on the cervical vertebra, there's also a hole. Transverse foramina in the cervical vertebra. So if you have vertebra just sitting in front of you, the way to tell the cervical ones is there's not only a central canal, the big vertebral foramen where the spinal cord goes through, but there's little holes in the transverse processes. So that's one way to tell. All right, the sternum. Okay, and if I color that purple or bluish, okay, there's the sternum. You can split that into 3 parts. This little part that sticks out down here at the bottom, or the most inferior part where the diaphragm attaches, is called the xiphoid process.
Sternum.
This is the body of the sternum, and the top part is the manubrium. But collectively, it's called the sternum. And then you have ribs attached to the sternum, and the ones that are attached directly to the sternum, which are the first 7, are called the true ribs. And then the next 5 are called false ribs, but these 2 are attached up at the same point, kind of, with cartilage. The 3 that do not come round and attach at all are called floating ribs. Or the 2, sorry. There's 2 that are just floating. And because these 3 are all kind of attached as one. So the bottom 5 are false, but the bottom 2 faults are called floating. Heaven forbid to make this easy, right? Yeah. Okay, so there's the ribs and the sternum, or the thoracic cage. This bone right here is the clavicle, sometimes known as your collarbone. Okay, and there's no special parts to the clavicle. It's just it's kind of shaped like an S if you look down on it, and obviously you have clavicle on each side. Okay. The clavicle is up here kind of at the sternum at one end, and it's attached, or it's not attached, but it touches the scapula. And if I turn this guy over and you look from the back, this is the scapula. Now the scapula's got all kinds of parts, but the biggest part is the spine of the scapula, that ridge
Scapula.
right there. And if I take the scapula, I think I can, there you go. See the scapula with the different colors there? The spine of the scapula in this picture is the yellow part, that ridge that comes out. The space above it, there's kind of a dip, and the word fossa means groove or dip. And because it's above the spine, it's called the supraspinous fossa. So superior fossa of and above the spine. And later, when you learn the muscles, the muscle that sits there is the supraspinatus. Underneath the spine is the infraspinous fossa. So the muscle under there is going to be the infraspinatus. So you have the spine of the scapula, the infraspinous fossa below, and the supraspinous fossa above. You also have this part that sticks out that's kind of red right there. That is the acromial process, because acromial means shoulder. And that's what is kind
Clavicle.
of the clavicle touches. When you feel your top of your shoulder, you're feeling the clavicle and the acromial process of the scapula. This part down here, underneath, is the coracoid process. And it's going to articulate with the head of the humerus and attach muscles and tendons. And didn't you have shoulder? I think you talked about your shoulder injuries. Yeah, the rotator cuff muscles are holding this all together, and if you pull it, tear it, injure it,
It's very painful.
yes. And it stays that way for a long time because it doesn't heal well because it's really hard not to move your shoulder. And how do you put a shirt on if you don't, if you can't rotate your arms and so even little movements, it's hard to not do. So the scapula is a pretty busy bone. Then there's the humerus. The humerus, the top, is called the head. Head just means a rounded whatever. So there's the head of the humerus, and it articulates with the socket place or the groove called the glenoid cavity on the scapula. So it's a ball and socket joint, and ball and socket joints roll and rotate. There's a bump on the humerus. Turn this guy, you see that bump?
Mm-hmm.
That's called the greater tubercle of the humerus. There you go. And then down at this end, the end that articulates with the radius and ulna, the ulna, I don't know if you can see that, but the ulna has like a C-shaped end. It looks like a U. That's how I remember that it's ulna. And it fits into the groove of the humerus and forms the hinge joint. The radius is actually, you look at it like this, it's got a rounded end, hence the word radius, rounded end, and it actually allows your wrist to twist. Okay, so bending your elbow is humerus and ulna, but rotating your wrist, that little rounded part right there of the radius is actually rolling against the humerus and ulna to allow for that rotation. All right, so if we go down further to his hand, and this hand is kind of goofy in front of him, so I'm going to look at this hand over here.
Scaphoid.
All those little bones, they have names, but just know them as carpals. And then the palm of your hand is metacarpals, and then your fingers are phalanges. So hands are pretty easy. Feet are tarsals, metatarsals, sorry about my phone, and phalanges as well. Turn this off. Okay, so that's arms. let's go down and do the pelvic region. Okay, and I'm going to get rid of his hands because he is not in an anatomical position and you can't see the bones very well. So we're going to get rid of his limb bones, which makes him look a little funny, but you know, whatever. All right, so the pelvic bone is actually 3 bones.
Ilium.
The ilium, which I will color yellow, purple.
Pubis.
The pubic bones, or pubis, we'll color blue.
Ischium.
And the ischium, which we will color white. Okay? Ischium are the sit bones. Pubic are the ones in the front. The ilium is the big one, and the edge of it is called the iliac crest. The hole is called the obturator foramen. Foramen means hole. Obturator, I don't know what that means actually, but that's the obturator foramen. The hole in the back of your skull where the spinal cord is called the foramen magnum, great big hole. The socket
Femur.
where the head of the femur fits in is called the acetabulum. Where that word comes from, I don't know, but there you go. I think there is ischial tuberosity that you'd have to know, and that's a bump on the ischium, kind of like this region right here. And then there's a piece of cartilage between the 2 pubic bones called the pubic symphysis. The femur has a whole bunch of parts you need to know. The dark purple part where the word femur is right now, that's the head. The green part is the neck. Attaches the head, just like our necks attach our heads to our bodies. This purple part here is the greater trochanter. And when you feel that hip bone, that's what you're actually feeling. It's the greater trochanter. Because up here, up a little higher, is your ilium. So you can feel that. All right, so the greater trochanter, and then you have the shaft of the bone, and when you get down to the bottom, you have the condyles, and the medial and lateral, depending on the medial is towards the middle. And it, again, kind of has a groove where the tibia articulates with it. The fibula actually holds no weight. If you break it, you don't get a cast. So break your tibia if you want a cast. Because that's a weight-bearing one. This just helps hold ligaments and the tendons. It doesn't really hold you up. But the tibia does, and the tibia has grooves on it that fit into that condyle. Okay. And then this is the patella, knee bone. The bump on the front of your tibia is called the tibial tuberosity. And if you click on that tibial tuberosity, and it is a pretty big solid bone. And when you get down to the bottom, there's a medial malleolus. It sits on top of the talus. The talus is one of the one of the tarsals, one of the ankle bones. And you need to know talus and calcaneus. So if you calcaneus is the heel bone, okay, and the talus is the one that the tibia is sitting on. You can see it a little bit better there than you can on this one. But if I color that so you can see it, come on, color. There we go. I can color this one too, so you can kind of see it in both aspects. And then the fibula, which is a wimpy bone. It's moral support right there. That's exactly it. And it doesn't really move very much. You really don't want your fibula to move. There's a pretty tight tendon, although if you sprain your ankle bad enough, sometimes there's a little movement that shouldn't be there anymore. Anyway, collectively, tarsals, metatarsals, phalanges. So far, so good? Yep. All right. The hard part is the dude's skeleton, or a skull, because your skull has so many parts. Okay? I'm trying to make this guy's head bigger so you guys or Caitlin at home can see it a little bit better. Okay, so
Frontal bone.
go with the easy ones. First are basically the flat bones. And they're named pretty much for the region, frontal bone. Okay, so we can color that. We turn them on his side. You can see
Parietal
parietal bone. And let's make that one red.
Temporal
See,
bone.
temporal bone. And if you turn it back far enough, you can see
Occipital bone.
occipital bone. Okay, so frontal, parietal, and there's another parietal, temporal, and there's one on the other side, and occipital. And then you got the sutures between them. The sutures between occipital and this one is the lambdoidal. Lambd. Weird. Lambdoidal. The suture between temporal and parietal is squamosal. The suture between frontal and parietal is coronal or frontal suture. And then the one between the two parietals is sagittal. So those are kind of named for direction. But squamosal, this one, and lambdoidal are maybe not words everybody uses every day. Now, the temporal bone is a freaking busy bone. I mean, there's a lot of parts to it. For one thing, there's a hole in it where your ear is, and that's called the external auditory meatus. Meatus means a canal through the bone. So external, outside auditory hearing hole is what external auditory meatus means. But they can't just call it the ear hole. That would be way too easy for A&P students to learn. So external auditory meatus. And then there's that, see that green part that sticks down? That's called the styloid process. And then there's a thicker part behind it that sticks out called the mastoid process. The mastoid process has muscles attached to it that are involved in moving your mandible, the only movable jaw or only movable bone in your skull. And it's going to help do that, masseter and some of the other muscles. The sternocleidomastoid muscle is also attached there. All right, so then if you go back to this, the temporal bone, notice that part of it meets this bone. This bone is the zygomatic bone, and part of it reaches back and attaches to, like that one red, to the temporal bone, that dark blue part, and that forms what's called the zygomatic arch, which does the shape of our face. I mean, a lot of, we all have all these bones, but our shape of our zygomatic and temporal bone and that zygomatic arch makes our faces look different. Okay, so I think that's the temporal bone.
Mandible.
Then you have mandible, lower jawbone, and it's the only movable bone, but notice it's got this process that sticks up of a mandibular process, and it's going to articulate with the temporal bone. There's like a little condyle there. It allows it, it's a hinge joint, so you can open and close your mouth. There's also a little hole right there on the mandible. Now it's underneath the word mandible. So if I make that beige there, that little hole is called the mental foramen. Nerves and blood vessels go, you have one on each side. Because remember, this is the mental region. The upper jawbone is the maxilla. The maxilla doesn't move, okay? But it forms, if I turn this guy back over, okay? I mean, even part of the nose is the maxilla. Kind of a weird shaped bone. And then, of course, you have the nasal bones. And the nasal bones form your nose, although the end of your nose is mostly cartilage, hyaline cartilage. That little bone just inside the eyeball
ducts
is the lacrimal bone.
Nasolacrimal ducts.
You have to take away the ducts. Lacrimal means tears.
Ethmoid bone.
Yeah, the ethmoid bone is there too, but the lacrimal bone is the first one inside your eyeball. To make that blue, And
Ethmoid
then
bone.
ethmoid bone. Now the ethmoid bone, oops, we don't want to make that one blue. Let's make that one yellow. The ethmoid bone is a crazy bone. It's everywhere. And it's hard to look at it by just looking at the, I mean, it is formed the inside of the eye socket, but it also forms, can you see, there's a part in the nose.
Frontal
So
bone.
I'm going to take away the frontal bone. Now you can see more of the yellow, the ethmoid bone. There's a part that sticks up in the skull called the crista galli. And on either side of the crista galli is the cribriform plate. And that, again, is part of the ethmoid bone. I don't know if I can, if you look down on this a little bit, this crista galli sticks up, and on either side, the cribriform plate, there's little holes there because when you smell, those smells become chemicals and diffuse across that membrane, and sitting on the cribriform plate are your olfactory bulbs. So you actually get smell to your brain quicker than almost any other sense. But that crista galli sticks up, and it
Nasal
also
bone.
continues down into the nose. If I take away the nasal bone, it forms part of the nasal septum. That part's called the perpendicular plate. And if you hit somebody hard enough, that perpendicular plate pushes up, the crista galli pushes up, and it breaks through the meninges and it kills you. Which is why it's illegal in boxing to come. You can punch somebody in the nose, but you can't punch them from below and push their nose up. And if you want to kill somebody, you jam your hand hard enough and push their nose up. It pushes the perpendicular plate, crista galli, and it breaks your membranes and you can die. Now,
Lateral process of septal
if
nasal
I take away
cartilage.
that cartilage right there, the bone,
Septal
the
cartilage.
bottom half of the,
Inferior nasal concha.
yeah, I know I have nasal concha. The bottom half of your nasal septum is your
Major
vomer
alar
bone.
cartilage.
I don't want any cartilage. But I want the vomer bone. I don't know if
Inferior
I can
nasal
get it
concha.
to. You have nasal concha, which are bone flaps in your nose, which are covered with mucous membranes. It just increases the surface area in there so you can make more boogers.
Vomer.
There's the vomer bone. The vomer bone and the ethmoid bone, the perpendicular plate part of it, form the complete nasal septum. So if I color that vomer bone red, you can barely see it. It's pretty small. But vomer and ethmoid form the nasal septum, which you can't really see unless you take a skull and look up their nose. And I can show you on the bones out there too. But vomer is a little harder to see. On top of that, the top of your mouth is the palatine bone. That's another one you really can't see unless you look up underneath. And
Mandible.
I take away his mandible and flip him up a little bit. To take
First
away his
cervical
vertebra.
vertebra.
See if I can get palatine bone. Whoops.
Occipital bone. Temporal bone.
See it.
Maybe take away his teeth?
Yeah. Let's take away his teeth. Teeth and ligaments.
Maxilla. Palatine bone.
There's the palatine bone. Now you have a soft palate and a hard palate. The soft palate is like your uvula, and that moves up when you swallow. So again, palatine bones are a little bit hard to see
Palatine
without taking
bone.
off the lower jawbone and tipping him up and whatever. All right, so let's put him back normal. Not sure he's normal. And look at the sphenoid bone.
Sphenoid bone.
That is the sphenoid bone. And the sphenoid bone looks a little bit like a butterfly when you look down on the top of the skull. So we took away the frontal bone so you could see more of it, but it does form the outside of your eye sockets. But when you look down on it, okay, you're looking down now on the sphenoid bone. Okay, so here's the top of his head. He's facing you. That part right in the middle is just like a little groove. It looks like a saddle.
Mhm.
It's called the sella turcica, which is I think is saddle in Latin or something. That's where your pituitary gland sits. And so sella turcica is on your list as part of the sphenoid bone. All right, so if we take away his
Parietal
parietal
bone.
bones,
Parietal bone.
okay, so you take away the top of his head. This is occipital, so this back of the head. There's that hole. That's the hole where the spinal cord comes in and out. That's the foramen magnum. Great big hole. I think that's most of the parts of the skull that you need to know. There's a lot on the skull to know. All right, so if we put him back, and maybe we put some of his parts back together. There we go. This whole skull.
It looks kind of evil with the colors right
Yeah, it does without the eyes in there. So that's pretty much the bones. People probably have more trouble with bone parts than bones. And for the A&P2 final exam, there's no pictures on the cumulative final for A&P2. So there's no bone parts. For the cumulative final in your class, it's mostly bones, just the major ones. I don't ask a lot of the foramens and tuberosities because I doubt you're ever going to have a patient ask you about the lateral malleolus. However, they might want to know the difference between tibia and fibula and femur.
Yeah.
You know, so I try to keep it more applied like you would be talking to a normal patient. And obviously, you guys aren't going to be normal patients. You're going to have heard of these things. But they're important when it comes to attachments of ligaments and tendons. And that's what a lot of your patients will have. Torn ligaments, tendons, I pulled a muscle, it hurts here. And at that point, the doctor, nurse, the medical team, whatever, has to figure out, well, is it a tendon, a ligament, a broken bone, a pulled muscle? You know, and obviously different tests would be done and manipulations to try to figure out, because there's a lot difference between a broken bone and a pulled tendon on how you treat it, you know. And the orthopedic doctor or doctors would know how to find that and then hopefully know how to treat it. But sports medicine is huge. I mean, there's a lot of people in sports, and so I'm assuming some of my students are going into that. And so muscles and bones would be, you guys would have to learn way, way, way more than what we list in A&P1. And probably blood flow, you know, what Kaylin just finished up, all the blood vessels, those would be important as well. So you can't get blood flow to a muscle. It can be the greatest muscle in the world. It's not going to do anything. Can't get any oxygen and nutrients there. And so blood flow, or if somebody, you know, had a bad enough injury where blood flow is impeded, even healing is going to be slower. Okay, I'm going to stop the recording right now.